Question number 8 regarding femoral nerve. Wrong statement. You have to find the wrong statement regarding femoral nerve. First is that it runs between iliacus and psoas major, passes below the mid-inguinal point. Saphenous nerve arises from its posterior division. It arises from the dorsal division of the anterior primary rami of L2, L3, L4. This you're seeing is lumbar plexus, and this one is L1 vertebra, L2, L3, L4, L5. And you know these lumbar spinal nerves, they emerge from below to the numerically corresponding vertebrae. So these are the anterior primary rami of the spinal nerves, L1, L2, L3, L4. So the green color one you're seeing is femoral nerve. It's arising from the dorsal division of the anterior primary rami of L2, L3, L4. In this image you're seeing is femoral nerve, and it's descending down here between the two muscles, iliacus laterally and medially it's the psoas major, to descend down into the thigh by passing below the inguinal ligament. This is psoas major and this one is iliacus. This is a schematic way of representing the branches arising from the femoral nerve. As you can see that this line, the green, the dotted line they have shown, this line is the inguinal ligament. So the two branches from femoral nerve arising before it crosses the inguinal ligament. One is branched to the iliacus and other is branched to the pectineus. However, this nerve to pectineus, it innervates pectineus after reaching into the thigh. Then around 2.5 centimeters below to this point from where it enters into the thigh, this point here is called midpoint of inguinal ligament. So 2.5 centimeter below to this, femoral nerve divides into its two division, anterior and a posterior division, as you can see in the image. They are splitted across to this artery, the lateral circumflex femoral artery. Anterior division descends anterior to this artery and posterior division crosses behind to this artery. So the anterior division you can see gives out these cutaneous branches. One is the intermediate cutaneous nerve of thigh and the other one is medial cutaneous nerve of thigh. And generally it's the intermediate cutaneous nerve of thigh which gives a branch that supplies sartorius, or sometimes this branch to sartorius may be arising from the anterior division itself. Mostly it's been seen that it's a branch arising from the intermediate cutaneous nerve of the thigh. Then the posterior division supplies to the muscles of the front of thigh. These are rectus femoris, vastus lateralis, vastus intermedius, vastus medialis. The important points here is that the branch to the rectus femoris also supplies the hip joint, while branches to these vasti, the three vasti, all of them, they descend down to supply the knee joint. But the proprioceptive sensations from the knee joint are carried by the nerve to vastus medialis. One important thing is you can see that the posterior division continues as saphenous nerve, which is arising from the posterior division of the femoral nerve. It perforates the deep fascia on the medial side of the knee joint and then it becomes cutaneous. And when it becomes cutaneous, it soon gives its branch called infrapatellar branch, which supplies the skin overlying the ligamentum patelli. Then it supplies skin on the medial side of the leg and it supplies the skin on the medial side of the foot up till the ball of the greater toe. So remember all these important points, and remember that saphenous nerve is a branch arising from the posterior division of femoral nerve. Now important points here in this image, the terminology regarding this inguinal thing. One is ASIS, anterior superior iliac spine, and the 2 points here, one is pubic symphysis, right? This medial most surface of the pubic bone which participates to form this secondary cartilaginous joint called the pubic symphysis. This upper surface here, this surface is called, the red thing I've drawn here, this is called pubic crest, and there is a prominence here, the protuberance here lateral to the pubic crest is called the pubic tubercle. So the two terminology, from ASIS to the pubic symphysis, the line or the fold created when you completely flex the thigh, right? So complete flexion of the thigh is when the front of thigh touches the front of abdomen. That happens when you're sitting in a squatting position, and that fold created is called inguinum. So the midpoint of inguinum will be somewhere here, and this point will be called mid-inguinal point. If it's asked what structure passes below the mid-inguinal point, then you'll say that it is the femoral artery that passes below to the mid-inguinal point. Then you're seeing is another structure that is in green color. From ASIS till pubic tubercle, there is a ligament. This ligament has a slight convexity downwards, and this is called inguinal ligament. So there will be a point somewhere here. This point will be called midpoint of inguinal ligament. Remember that 2.5 centimeter above to this, there will be a ring, evagination of the fascia transversalis, and this is called deep inguinal ring, around 2.1 centimeter above to the midpoint of inguinal ligament. One more structure that lies outside the femoral sheath, that's the structure we are discussing in the question, and this structure is femoral nerve. Femoral nerve runs outside the femoral sheath. Femoral sheath is a continuation of fascia iliaca posteriorly and fascia transversalis anteriorly into the thigh. That sheath has three compartments. Lateral compartments is femoral artery that passes. Middle one is femoral vein, and the medial one is called the femoral canal, where you find is the lymph node of Clockwitt or Rosenmuller. And here there will be rounded, horizontally placed ligament called the lacunar ligament. The important point here is that femoral nerve you're seeing is also passing below to the midpoint of inguinal ligament. This is another image explaining the same thing. Here it is ASIS, here it's pubic symphysis, here you have pubic tubercle, and the line joining ASIS to pubic symphysis is called inguinum, the fold created when you completely flex the thigh. And from ASIS till pubic tubercle, here this ligament is the folding of the aponeurosis of external oblique abdominis, which is slightly curved downwards, convex downwards because of the pull from fascia lata. This is called inguinal ligament. So this will be the point here, the midpoint of inguinal ligament, and here it is the mid-inguinal point. So you can very well appreciate that which point will be medial and which will be lateral, because lateral point of both the things is the same. The lateral point is ASIS, but medially there are two different points, pubic symphysis and pubic tubercle. Obviously, the line which is longer and reaching more medially is the inguinum. So the midpoint of inguinum, mid-inguinal point, will be medially placed, while this inguinal ligament is actually a little shorter than inguinum because pubic tubercle lies laterally to the pubic symphysis. So midpoint of inguinal ligament will be a little lateral to the mid-inguinal point. Here also you can see in a lateral image, where you're seeing is this space called the acetabulum. Here it's pubic tubercle, here it is ASIS, and this is the inguinal ligament. This is iliacus muscle. This is psoas, and I have taught you before that this nerve, femoral nerve, you can see is this. This is descending down between iliacus and psoas major, and it is running outside to this sheath. This sheath you are seeing is called the femoral sheath. Femoral nerve is running outside and lateral to the femoral sheath, below to the midpoint of inguinal ligament. And this is femoral artery. This femoral artery is running in the lateral compartment of the femoral sheath, below the mid-inguinal point. So the answer to question number 8, the wrong statement is that femoral nerve runs between iliacus and psoas major is correct statement. It passes below the mid-inguinal point. Now this is going to be a wrong statement because you know that femoral nerve passes below the midpoint of inguinal ligament. However, saphenous nerve arises from its posterior division is correct. Arises from the dorsal division of anterior primary rami of L2, L3, L4 is also correct.